you all today, and this afternoon we're taking another step to make it easier for our residents to live longer and healthier lives. Today I'm proud to sign a bill that was championed by Councilwoman Blondell Reynolds Brown, as we know, a longtime public health advocate. We all know that Philadelphia is a city with great food and fantastic restaurants, but for many people, eating out can raise concerns because they don't have the information they need to make healthy menu choices. This bill will help people avoid foods with extremely high levels of sodium, so they can go out and enjoy themselves while still taking care of their health. The bill will help to change the future for many Philadelphians. It builds on our work to improve our parks and recreation centers so that young people can get exercise, and on our partnerships to improve the nutrition of food served by city hospitals, and so much other work aimed at creating a healthier future for our residents. So I want to personally thank Councilwoman Brown and her colleagues at City Council for passing this measure, and to all those community members, restaurant owners, and health experts who helped make it happen. And I'd like to thank you all, and I'd like to ask Councilwoman Brown to please come up. Thank you.
Good morning, good morning. Hello. Okay. I share with the mayor, I'm delighted to be introduced as a public health advocate. So welcome and good afternoon. Today for sure we are indeed making another installation in the wheel called nutrition labeling information. And as a former teacher, I could not resist sharing with you this quiz that's on the back. I'm asking all of you to take it and to test your own knowledge base of how well you know menu labeling and what's good for you and what's not. I want to say thank you again to the mayor for his important support, as was demonstrated by members of his administration, because without the health commissioner and his team, we simply could not get this done. And I would be remiss not to say hello and thank you to my colleagues, because at the end of the day, it's about 9 votes and ensuring support for something that we think is going to improve the lives of those who are in our city. Background is very, very important. The initial trigger for my interest in wanting to learn and understand the value of nutritional information was essentially based on 2 things. Personally, I was and do and will forever continue to struggle with weight gain and weight management, and that became real evident after I came to City Council on how I was going to figure out how you get to the gym so I could manage my weight. I felt then at that time that I needed to find what else I could put into my GPS dieting system. On a public policy level, well, first of all, I decided I'll never lose the battle, or I might lose the battle on weight gain, but I would never lose the war. And nutritional information, I've discovered, would make a difference. 4 years after arriving here, I was invited to be a Robert Wood Johnson Fellow. And during that time, we looked at systems and how systems were working or not working for children around the country. The National Institutes of Health at that time released a report that talked about the alarming rise of childhood obesity nationally, and worse, the public health crisis it was in the African American community. And when former City Councilman Jim Kenney and Mayor and I and other legislators look at an issue, for me the question always is, and what role can government play in making this circumstance better? Fast forward, as a result of reading that report, we introduced the menu labeling bill in 2008, as I was just sharing with the health commissioner. And it took us 24 plus months to garner enough support after much testimony and a gazillion meetings, helping people or informing people, or in some instances persuading citizens and heads of various organizations that nutritional information does have value, and when people have it on the front end, we actually do make different nutritional decisions. And so in December of 2010, after about 4 years of a lot of work, we were able to pass that bill 12-5. Fast forward now to our sodium bill, which I said already is another installation in improving nutritional standards. We did the homework. This was an easier lift because the Heart Association and a number of other persons shared with us the science that supports why knowing information about sodium makes a difference for those of us who struggle with all those diseases associated with that. So celebrating the passage of this measure or any measure requires collaboration. We cannot work in a vacuum. that you live in la-la land if you think it can introduce a piece of legislation and it's going to happen without listening, learning, and hearing from all sides of an issue if you are serious about wanting to arrive at a remedy that's going to improve the outcomes for those at risk. I want to thank Dr. Thomas Farley, who was a leader in this issue, and Dr. Cheryl A., I don't want to mispronounce the name, Betty Gold? Okay. For not only for being here, but for offering very early on your insights and feedback on this bill. That collaboration has made this morning possible. There were other partners, the Law Department, for sure, researchers from the University of Pennsylvania, the American Heart Association, the Center for Science in the Public Interest, the Restaurant Association, and I personally had a few meetings with Wawa and their representatives, along with other restaurants operating in the city who worked with us hand and foot to craft, refine, tweak the bill so that it would not be onerous and so that we would arrive at a place that we could all live with. This today is a proud moment for our city because we now become, what number city are we in the country? The second city in the country that has intentionally and strategically expanded our current menu labeling legislation. The good news is that in May 2018, the federal government decided to follow in Philadelphia's footsteps and enforce calorie labeling on restaurant menus nationwide. Philadelphia, of course, had been doing this for years, and now today we're including sodium warning labels in the near future. So we join New York City as two big cities in the country that require sodium menu labeling at nationally recognized change. Fact, research has assured us that when consumers are informed about nutritional content, consumers make better nutritional decisions. One of the myths was that, of course, when we walk into a restaurant, we'd be more than willing to go on our phone and pull up a particular menu item and figure out what the nutritional content is. We're not doing that. Folks want to see it when they open the menu. Our city's population ranks among the highest at risk for premature heart disease among big cities in the United States, with even higher rates, of course, amongst African Americans. Fact, approximately 466,000 adult residents of our city have hypertension. That's nearly 500,000 people, or 4 in 10 adults. And we know that equals extreme healthcare costs to the tune of $696 million. So providing that information at what we call point of purchase makes a difference. Today, this bill to become law with the mayor's signature indeed better informs, educates, enlightens our citizens to make better health choices. If a menu item must have a warning label placed next to it, then maybe the menu item should be reinvented with different ingredients or replaced. Maybe that's the next step for us, you think? We're going to explore that. Knowledge often, we know, gives you power. And with this legislation, citizens and consumers who visit our restaurants in our cities will have the power to choose and to choose widely. So in the end, this is another installation. The work is still not done. Again, I want to close by saying a huge thank you to all of the partners who worked closely with us over the last 18 months to make this morning real. And one of those partners is our health commissioner, who's been with us since February 2016. And our next major mountain that we're going to climb, Commissioner, is expanding our lead bill. I just want to give you a heads up, okay? This session. One of his heroes in the world of public health is Tom Creedon, who is the Centers for Disease Control Director. I'm pleased to introduce to some and present to others our Health Commissioner, Dr. Farley.
Thank you very much. You know, part of good public health policy is giving people the information that they need where and when they need it. And what this bill does is it applies that principle to a big public health problem, which is high blood pressure. You know, 90% of us are going to have high blood pressure at some point in our life, and 60% of people in their 60s have high blood pressure. It's so common that we think it's a normal part of the aging process, but it isn't. High blood pressure is preventable. One reason why nearly all of us will get high blood pressure is we all take in far too much sodium over our lifetimes. As a matter of fact, on average, Americans take in about 50% more sodium than the maximum amount that is recommended. If you take in years of high sodium, that raises your blood pressure. You get high blood pressure, that increases your risk of heart disease and stroke. Now, in Philadelphia, we have some of the highest rates of high blood pressure and the highest rates of early death from heart disease of any city in the country, so it's particularly important here. In the health department, we're not going to accept those statistics. We're going to act. That's what we do. Now, contrary to popular belief, the major source of sodium for us is not the salt shaker. 3/4 of the sodium we take in is already in the food when you buy it. It's in processed food that you buy at a grocery store, and it's in restaurant food. Some restaurants have individual items that have way too much sodium. More sodium in an individual item than you should take in an entire day. That's more than 2,300 milligrams. We think that if that's the case, then people ought to know that. They ought to have that option. Those food items don't taste especially salty, so there's no way for people to know that they have more than a day's worth of sodium in one item. So this warning will let them know that. This bill will make it easy for them to identify those items that have very high levels of sodium, and then they can choose whether they want to have it anyway or whether they want to have a different menu choice. So this is just one step, but it's an important step to the overall health department's and the city of Philadelphia's efforts to lower all of our sodium intake, to lower our levels of high blood pressure, and reduce heart disease and stroke in the city. So I personally want to thank Councilwoman Reynolds Brown. When we talked to her about this early on, she was immediately supportive. She worked through all the difficult aspects of bringing it into law, something that only an experienced council person can do. I really congratulate her for that. Before I finish, let me just say, in case any restaurants hear about this today, you don't have to put these warning signs up for another year. But I would encourage you to start putting them up now, because you're going to need to do it in a year. And if you don't want to put these warning signs on your individual menu items, maybe you ought to change the recipe. So you don't have to put the warning signs up in a year, which would be a win for everybody. So thank you very much. And now I want to turn it over to Dr. Cheryl Bettigold, who's the Chronic Disease Medical Director, who really made a lot of this happen.
So thank you all for being here. This is a good day. This new warning label helps with a question that so many patients have asked me over the years, which is, how am I supposed to know what I can eat and what I need to stay away from? As Dr. Farley just said, there are so many people in our city struggling with hypertension who just can't figure out what actually is healthy when they're trying, and this bill gives us a tool. So for all the many Philadelphians who are trying to watch their diets, whether they're trying to control high blood pressure that they already have or they're trying to prevent it, these new sodium warning labels really are a tool in the toolbox, very much needed information. Studies show that customers at fast food restaurants consistently underestimate the sodium content of the food that they're purchasing and eating by about 1,000 milligrams. And for the higher sodium items, they underestimate by even more than that. The science behind this warning label is solid. Research shows that the design, by including the words sodium warning, is easy for customers to understand. So it doesn't take a lot of explanation. You look at it, you say, yes, I understand what this thing is. And the label is just one of the many steps the city is taking to try to lower the sodium intake of all of our diets and make it easier for Philadelphians who want to be healthier. For example, our healthy procurement standards for food served by city agencies, which is millions of meals per year. Our Good Food, Healthy Hospitals initiative, which is a partnership with 16 hospitals in the city to serve healthier food that follows voluntary guidelines. And I really want to highlight this one today because we have folks from this project here supporting this bill, Healthy Chinese Takeout Initiative, which is a partnership between the health department and nearly 200 takeout Chinese restaurants working on lower sodium food. So I'm so grateful to City Council and particularly to Councilman Reynolds Brown and to Mayor Kenny for taking this step to help Philadelphians who want to control their health to have the information they need to do so. So thank you all. And I'd like the Get Healthy Philly team to join me up here.
friend. How are you? Good to see you. Good to see you. I'm just in the restaurant. We're working together. Instead of fighting it. Good to see you. How you doing? Good to see you.
That's okay.
Wonderful. Thank you. Thank you.